Hey, in here for another visit. It's Dr. David Klein of the Stages of Life Institute. Write this down and use it. StagesOfLifeVitamins.com, StagesOfLifeVitamins.com. Okay, doctor, hormone replacement after menopause. What are we talking about here?
You betcha. Okay, and this is sort of an interesting controversy going on, although I don't think it's very controversial at all, but it just happens to be that right now the medical community is divided as to whether or not hormone replacement therapy after menopause is a good idea or not. And I weigh in very, very heavily on the side that, well, guess what? You're not dead, okay? And so the fact that your body thinks that you should be dead doesn't really mandate the fact that maybe you might not want to enjoy your retirement. And here's what happens in nature, okay? Women lose their value to nature after the age of procreation. Now, this is the way it is in the animal kingdom. You know, once they're no longer fertile, away they go. They're banished or eaten or killed or whatever. And that's very much what happens in nature with women and had for the past 200,000 years. Only recently are we now able to live much past 40. At the turn of the 20th century, life expectancy was about 40, 42 years. When Social Security was written into effect in the 1930s, it was expected that 1% to 2% of the population would live to 65. Okay, that's why they chose 65 as the age of retirement, because you were not expected to get there. They kept moving the goalposts downfield. Well, guess what? 65 is rather young right now, isn't it? Okay, You're going to look at it and you're going to think, well, I've got at least another 20 years to go, 25, maybe 30 years to go. And well, you might. But your body, on the other hand, lost a couple parts maybe when you were 40. It could have happened when they did that hysterectomy. It could have happened when they gave you that Lupron. It could have happened when they gave you the birth control pills. It could have happened for any number of reasons, but you find yourself going through menopause. So you're no longer fertile. You're no longer ovulating. Does that mean that you can no longer have intimate relations with your husband? Fast way to lose a husband, okay, and a fast way to lose interest in life? The answer is no. This is absolute nonsense. So what is menopause and how does this happen? Well, women will see a decrease in their estrogen levels after menopause. They drop off fairly rapidly. Men, on the other hand, it is not fair, but their estrogen levels climb with age. So their prostates enlarge as a result. They become Oprah fans and so on and so forth. However, with women, estrogen diminishes. But before that estrogen goes away, long before the estrogen goes away, the testosterone left. What does this do? This leads to osteoporosis. It leads to heart disease. It leads to dementia. It leads to lack of focus. It leads to depression. The immune system goes to hell in a handbasket. Followed now by progesterone decrease. And what does this lead to? This leads to hot flashes. Now, note, you have plenty of estrogen left, but the progesterone disappears and now the hot flashes kick in. This is when people start developing breast issues, breast cysts. They start to enlarge. The fibroadenomas start to go up. Endometriosis becomes a bit of an issue. It's the progesterone that fires off. It's the loss of progesterone that causes most of the menopausal symptoms, not the loss of estrogen. When the estrogen goes away, and it's gone, and it will go, hot flashes go away. So now you think you're healthy? Now I think you're dead. Okay, when you have no estrogen, no progesterone, no testosterone, or no meaningful levels, it's as if the body died, okay? It is not a good place to be, even though the hot flashes go away. So what do? We argue. Why do we argue? Well, because I was told by my hairdresser that, if you take estrogens, it can cause cancer. And the fact of the matter is that isn't true. It's never been demonstrated, okay, that taking estrogens, that's bioidentical estradiol, or estriol, or estrone for that matter, has ever caused a single cancer. It has never been so demonstrated. Why is it that breast cancer, endometrial cancer, ovarian cancer go up in incidence when you're postmenopausal, when you have none of these hormones on board? If it was causal, if these hormones caused the cancers, it would happen at a young age, not an old age. So statistically, it's never been happened, but doctors, by and large, have a congenital lack of genitalia. Okay, they don't have the guts or the gumption in order to take on this particular topic. And it's a whole lot easier to tell a young lady, well, gee, I guess you can dry up and go away. Suck it up, be done with it. And this is criminal in my mind's eye. I think it's wrong. Why? Because you still have your life to lead. If you lose your testosterone, your skin will thin out. Starts to become parchment-like. Look at your hands. Okay, if you can see the blood vessels through your hands, okay, it's likely to be a testosterone deficiency. Progesterone, deficiency leads to sagging of the face. So you think you're going to go in and get a facelift and fix it? No way. It ain't going to work. Why doesn't it work? Because you need the hormones on board in order to maintain your muscle integrity, tone, and thickness. It's very, very important for you to feel good on the inside, and when you don't, because of these hormone deficiencies, you're going to look lousy on the outside. I don't care what you spend doing aesthetic work. It is not going to do a lick's bit of good for you. You can spend a fortune, but if you don't take care of the hormone business first, it's a losing cause. Now, what about the psychiatric issues involved? Okay, everybody jokes about women when they go through menopause. It's not much of a joke when your old lady is going through menopause. Okay, it's kind of like what I was taught in the military, and it was keep your head down, spread out, stay loose. Okay, because she can't kill us all. Okay, and unfortunately, these hormones affect every cell in the body, to include the brain. Okay, it is very, very common for people to become very depressed, angry, irritable, and cause domestic issues. It is no joke that divorces start to occur right around the time when menopause starts to start. That's just the way these things go. I don't think it's a coincidence. So in order to maintain domestic tranquility, you can rely on the Constitution on the bigger parts, but around your house, you better rely on your hormonal constitution. So what does it take to deal with this? Well, it's not enough to go into the doctor's office and tell them you have hot flashes. What's the next step? Well, here's an estradiol tablet or a patch or whatever, which will do nothing but make it worse. You can't guess what you're doing in this. It has got to be measured. It has got to be concerted. It has to be directed. It has to be precise. So what do? You measure. You do blood work. You find out what your blood level is of estradiol. What's your blood level of progesterone? What's your blood level of testosterone? And the values are important, but the ratios are more important. You need to know your cortisol level. You need to know how your thyroid's doing. Because if you don't have any thyroid on board, nothing works. If you have no estrogen, oddly enough, you're going to test normal for thyroid disease. You have to have enough estradiol in your bloodstream for TSH to be secreted. So I have a lot of patients come through the office and they're told, well, my doctor checked me for thyroid disease and it was normal. And I go, yeah, you have no estrogen, so you're going to test normally. But your temperature is 97 or lower. You can't tell me that that's healthy, because it is not. So it's very, very important. It's of paramount importance that you know what your numbers are. We're all taught, okay, you need to know what your cholesterol is. You need to know what your blood pressure is. That's great, okay, but if you're not happy, you're not sleeping, and you're not having relations with your husband, I don't care what your blood pressure is. I don't even really care what your cholesterol is. You are not going to be having a very fulfilling life.
So how do they go about finding identical hormone?
Okay, there are people out there that are worried about what's natural and what's unnatural.
Yeah.
Okay. Well, really, the argument isn't natural or unnatural, because you can't replace or administer human hormones to people without having to kill some folks. So what do? Grind people up and extract their hormones? No, you can't. So you extract them, the precursors, and then they're made synthetically. What you're looking for is something called bioidentical. Bioidentical means it's precisely the right molecule for that for that purpose. So human estradiol can be synthesized. It's the way it goes. Now, we're not talking about conjugated equine estrogens. We're not talking about Premarin or Prempro. Those are not human estrogens and progesterone. It's a progestin. It's an anti-progesterone. So what you're looking for is the appropriate chemical, and you want it in the appropriate dose. The appropriate rate, route, and amount is what you're looking for with this. Now, there are people out there that'll put the patches on. Do I think that's a good idea? Well, I'm not so sure that it's a bad idea, but there are better ways to do it. What about the oral tablets? Singularly a bad idea. Why? Because they hit the stomach, they then get absorbed in the small bowel, hits the liver, and then all of a sudden something magical occurs. It gets detoxified, quote unquote, and sex hormone binding globulin is secreted into the bloodstream, and it ties up what's left. So you can never get a really good predictable level in somebody with an elevated SHBG. So the way I prefer to do this is through the skin, using pulsed doses in the morning. So you wake up in the morning, you shower. The skin is now moist and it's warm. You then apply the medication to the what's called the volar aspect of the forearms, the inner aspect of the forearms. Why? Because there's no fat there. You rub the forearms together, it goes right into the bloodstream. Now, there are doctors out there, there are pharmacists out there, God bless them. They'll tell you to rotate the sites, and I would wish them well. However, this is misguided. Reason being is that the volar aspect of the forearm is the only place in your body that has no fat. Okay, now these hormones go through fat tissue and they become metabolized in rather predictable but unhappy ways. So you need to do it right, you need to get the right amount, and you need to get it down properly.
And did you know if you go to the Stages of Life, not only do you find Dr. Klein, a nutraceutical store, but they have a lab on site? There you go. All right, here's more contact information.
Our phone number is 407-679-3337, and our website is stagesoflife.net. We're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And let's see, our office hours are Monday through Thursday, 8 to 5. The health store that Rob mentioned with all of our nutraceuticals is open during those office hours, but we're also on the web, as I said, at stagesoflife.net, and you can purchase your nutraceuticals at your leisure, and we will ship them to you.